What do all of these children have in common? At first glance, it would seem that they would not have too many commonalities. They're ethnically diverse, they're a mixture of genders, they're wearing different colors, they might even come from different socioeconomic backgrounds. But behind these children's smiles, they do have one thing in common. They all have cavities. Cavities are the #1 disease ravaging our children today in our modern and civilized society because it is the least prioritized need according to adults and even insurance providers. This lack of prioritization can prove to be a deadly mistake, as 1 in 10 of these children can die from their cavities. I'd like to tell you a story about 12-year-old DeMont Driver from a community just outside of Washington, D.C. DeMont grew up in a low-income household but had a rich family life with a loving mother and father who provided DeMont health care under Medicaid. However, it wasn't until 2010 that preventative oral health care for children was covered under Medicaid. Unfortunately, DeMont died in 2007 due to a brain infection stemming directly from a cavity. As a dental hygienist, the obvious portion of my education consisted of knowing everything and anything there is to know about the teeth. However, what most people don't know is that majority of the academic rigor spent in dental hygiene school covers the entire body and how the mouth interacts with it. Since being out in the field, I have dealt with children and adults alike, and I can attribute the lack of prioritization for children's oral health care to 3 factors. The first is the cost of treatment. Most think that drilling and filling is the cheapest and easiest option for our children. The second misconception is that cavities are a natural part of growing up. The third misconception is that what happens in the mouth stays in the mouth, but that could not be further from the truth. Well, we'll start at the top, about addressing the barrier of cost. Let's do some math. In 2011, 56% of children under the age of 12 had a cavity. 70% of them had more than one. Each drill and fill costs about $200 to $300. If the decay is really bad, it costs $100 for an extraction. By contrast, a once yearly preventative oral health care cleaning and exam costs $80 under Medicaid, which is significantly cheaper. Factor in a toothbrush every 3 months and some toothpaste, you're looking about $15 to $20 every 3 months. It's going to be a lot cheaper to prevent the cavities from coming than it is to treat them once they've gone too far. A hospital oral health visit costs about $280,000. This is not factoring in the cost of anesthesia or a hospital room overnight for recovery. That is the bill that sweet DeMont Driver's family was saddled with long after his death. They paid 9 times as much as it would have cost for preventative oral health care maintenance than it would to take their boy to the hospital for his cavity. The second misconception is that decay is natural. Children get cavities, it's just a part of growing up. Decay is not natural. It's the body reacting to being under attack by the acidic byproducts of oral bacteria. These oral bacteria can be passed from parent to children through sharing of utensils or food or drink. While some amount of oral bacteria is good to help maintain the pH of your oral environment, to help you digest, and even as a protective barrier to viruses and pathogens. However, when the bacteria grow to be too numerous, they overpower your body's defenses and begin to break down the hardest substance in your body. That's your enamel. Baby teeth are also very important during children's development. Even though a baby tooth can fall out and a permanent tooth comes back, hooray for second chances, the chances of that permanent tooth being decayed are significantly higher if the permanent tooth has fallen out. Also, Primary teeth come out in a particular fashion during development. They serve as a holding place for the permanent teeth to come out. So if a baby tooth falls out prematurely, the permanent tooth can come in at a disadvantageous angle, leading to a less than functional smile, which could result in braces down the line, which we all know are pretty expensive. And this rounds back to my original point that cost is a huge barrier and a reason why oral health is least prioritized need for children. But I digress. I'd like to talk about my third and final misconception, which is the most dangerous. That is that what happens in the mouth stays in the mouth. Our mouth is the gateway to our body. Our tonsils, lymph nodes, nervous system, the pH of our saliva, all of these microscopic things serve as defensive checkpoints for whatever enters our mouth and into our bodies. Our body has immune responses to invading bacterium that can lead to some pretty drastic results. When bacteria settle into the crevices of our teeth and we are unable or unintentionally going to wipe away the plaque from it, we are providing a veritable buffet of food to those bacteria. They eat what we eat and fail to remove. Bacteria, as a result, produce acid, which penetrates our enamel and breaks it down. The further that acid penetrates, the further that bacteria can invade into our tooth. Soon it will reach the pulp, which is the hub of our tooth that connects it to the rest of our body. Bacteria can enter blood vessels and arteries and spread to anywhere else in the body. Most likely the brain, since that is the next closest hookup. If there was more patient education on the effects and risks and basic biology of the spread of cavities into the body, there might be more of an urgency to prevent such cavities from occurring and taking care of them before it's too late. In summary, oral hygiene starts at a very early age. Investing in the oral health of children should be emphasized and promoted so that it becomes a priority of parents and providers. Children's primary teeth are important for permanent teeth development in the future. The mouth is connected via many pathways and systems that can benefit or harm us. And because cavities are the #1 disease affecting children in our modern and civilized society, prioritization of children's preventative oral health is a must. Because of the full media coverage of DeMont Driver's death back in 2007, more free and low-cost clinics have opened up for children. However, how many more children will it take to reinforce the urgency and importance and cost-effectiveness of preventative oral health for children? Let's not wait until another child's life is on the line before we make this a priority in our nation.